Well, we heard from Senator-elect Scott Brown last hour that he will be heading to Washington tomorrow. His victory in Massachusetts brings an end to the Democrats' 60-seat supermajority in the U.S. Senate. That means it could have a huge impact on health care reform, on the debate in both houses of Congress. Let's get to Eric Cantor. He's the House Minority Whip, Republican of Virginia, of course. Congressman, good to see you. You've been handed, as a Republican in leadership, a gift. What will you do with it?
Well, first of all, Jane, I think that the election last night sent a strong message, and that message was a rejection of the arrogance that has taken hold here in Washington. And just like the voters in Virginia and New Jersey several months ago, the people of Massachusetts have said, you know what, we are tired of being told by Washington how to think. And why isn't it that just for once you can listen to us? Listen to us as far as this health care reform is concerned. Listen to us about our priorities. And that is, why don't you, Washington, try and begin to focus on the #1 concern of ours, which is jobs?
Congressman, I'm going to stop you there for a second. I want to play a clip, in case our viewers didn't see last night, with Sean Hannity. Frank Luntz, who does those great focus groups, did one on the race. I'm going to take a portion of it and get your response after it.
Why'd you switch?
I'm an independent, and I always believe that government should be ruled from the center. And in the last several years, including the last year, it's been that 10% to the far left and that 10% to the far right, and I want to change.
So is this a vote in favor of the Republican candidate, or to send a message to Washington?
Send a message to Washington.
Send a message to Washington. It wasn't, according to those people in that group, love for the GOP that got Scott Brown elected. It was a real repudiation of what they're seeing across the board. The Democrats will say you as Republicans have done nothing to help bring about the correct change.
Well, the reality, Jane, is here in Washington, the president was elected on this agenda of hope and change. Speaker Pelosi, Leader Reid in the Senate, they have full control of Washington, and I believe what the people of Massachusetts have now seen is the type of change that they were hoping for has not materialized. And the people of Massachusetts, like those across the country, expect a lot more out of their government, and they expect their government to start working for them. So by electing Scott Brown to become their senator, I think that they looked at an individual such as Mr. Brown to say, you know what, he can stand up. He can begin to be that check and balance against an agenda and a president and a leader in the Senate that is far outside the mainstream of where most Americans are.
So, Congressman, I guess I go back to my first question. You now have been handed this momentum as Republicans. What specifically do you do with it?
Well, you know, I've been in discussions with some of the leadership here in Congress, and it's very clear to me that the Speaker Pelosi, Leader Hoyer, and Whip Clyburn are very intent on jamming through the Senate health care bill through the House. And we're doing everything we can from the House Republican standpoint to defeat that bill. And if that means trying to allure and attract Democrats in the middle to our cause, that's what we're about doing. We have a full-thwarted effort that we're undertaking right now.
Congressman, I truly just have 10 seconds left, but as it stands today, if they did try to get the House to pass that Senate version, would the Democrats have the votes they need today?
I don't think so, but you know what? I don't know. And that's why we are trying to say, come on with us, stop this bill, so we can push the reset button and really talk about what should be done. But this bill is not what America wants. It's not what we need.
Congressman Eric Cantor, Republican of Virginia, good to see you. Thanks.